I'm Dr. Andersen with Family Health and Rehab, and in this video, we are going to solve that age-old mystery of ice or heat. So what do you do if you are ever injured? Do you put heat on it, or do you put ice on it? That's something that's been going back and forth for years. In fact, some of the confusion even comes from the professionals. So let me explain it to you in a manner that has science on its side. So think about this. If you are dealing with an injury and you put heat on it, you are going to cause more blood to come to the surface, therefore increasing inflammation. So when we start talking about heat, yes, it feels wonderful. I love heat. I moved from Alaska to get away from the cold. But when you put heat onto an area, you're going to cause more blood to come to the surface. And here's the reason why. When your body is starting to overheat, it's going to send blood more to the area that is close to the surface. It's going to increase the dilation of the blood vessels, causing more blood to go to the area, allowing the body to off-gas the temperature. And like I said, heat feels wonderful. But when you take the heat off, after an hour, what do you feel like? You actually hurt even worse. And the reason why is because you have more chronic long-term inflammation on the area that is injured. So the answer really is, how do we get the inflammation to go down? And when you put ice on it, when you put something that's cold onto an area that is close to the skin, your body is going to think that it is outside, that it is in the cold, and is going to go into self-preservation. And it'll pull all the blood back into the core to help protect the vital organs that your body has. And when you reduce the inflammation because you're restricting or constricting the blood vessels to that surface area, then the inflammation is going to go away. Long term, after you take the ice off, yes, your body is going to warm up, or at least that area is going to warm up, but you don't have that residual inflammation. Now, the rule of thumb with ice is that you never want to leave it directly on the skin. So you always want to wrap it up, and you never want to keep it on your skin or on that area for more than 20 minutes at a time. So you have to take it off, and you take it off for 40 minutes at a time. And the reason why that you have to take it off for 40 minutes at a time is you have to allow the tissue area to warm up again. If you put ice back on it before that area warms up to its normal temperature, you do run the risk of getting frostbite. And frostbite is when your cells start to die off, and that's the last thing that you need. So there you go. There's your answer. If you want more inflammation, you put heat on it. If you want less inflammation, you put ice on it. And that's how you reduce your inflammation. Simple equation. Less inflammation, less pain. More inflammation, more pain. So hopefully that answers your questions. If you have any questions additional, by all means, comment below. We'll do our best to answer them. We love having comments, and we'd love to have you share this with your friends. Thank you for watching.